When we use the word belief, we are generally talking about something that is conscious, some take on reality that can be consciously articulated, like, I believe in God, or I believe we should all love each other. In other words, we are usually talking about the conscious perspectives held in our neocortex, the more rational thinking part of our brain. But the truth is, we have unconscious beliefs as well. These are the ones held primarily by our subcortical brain, in other words, the part underneath our cortex. You might have heard this area called our emotional brain or limbic system. The beliefs held in these deeper areas of the brain are less conscious simply because of how the brain is wired, but I would venture to say they are perhaps more powerful. In psychology, we call these deeper beliefs our schemas, and they tell us all sorts of things about our own value, what is dangerous, how to stay safe. They often have coded very specific truths, like, if I ever say no to anyone, they will reject me. Now, most forms of therapy focus on changing our conscious thoughts or beliefs, but don't work as directly with our unconscious ones, in other words, with our schemas. That is why I'm making this video series to introduce you to a model of therapy called Coherence Therapy that was designed specifically for this purpose. In the previous video, I gave the summary outline of Coherence Therapy and how it works to update our schemas. But in this video, I want to take a deeper look at schemas themselves, specifically how they are structured, as well as why and how we can use language to get them accurately mapped. So let's dive in. I'm trying to fall. While I've explored the concept of schemas in other videos, in this video I would like to get into a bit more detail, starting with how schemas are structured. Schemas, at least those that have the most psychological relevance, are generally two-pronged. One, they hold information about the nature of some problem or danger, and two, information about the nature of its solution. Let's explore those two segments of a schema through the use of an example. Let's say a person comes into therapy wanting to change this pattern where she yells at her kids. Especially when her kids are doing anything close to misbehaving, this client just really loses it. As it turns out, when this person was young, both herself and her younger brother were abused, sometimes physically, by an alcoholic father. So, as a child, this client felt a lot of responsibility for protecting her younger brother, and the only way she could figure out to do that was to try to keep her brother in line so as to not draw Dad's wrath. How did she do this? Well, by herself yelling at brother anytime he was about to make a mistake. Almost like if she could be mad first and correct the problem, maybe the behavior would stop before triggering a worse response from Dad. So let's use that example to practice identifying the structure of a schema. In this case, what was the problem part of a schema? Well, it was the living knowledge that at any moment, my younger brother is vulnerable to being abused by Dad. That's a problem, or a danger in this case. You can think of this part of the schema as like an embodied knowing about the existence of a type of suffering that myself or someone I care about is vulnerable to. Now, it only makes sense that anytime our brain learns about the nature of a problem or suffering, it will naturally try to find a solution. So what would be the solution portion of the schema then? Well, to harshly keep brother in line so as to prevent worse abuse. Now, this example demonstrates something important about our solutions, which is they often aren't perfect. For one, they have costs, sometimes huge costs. Like in this case, for an older sibling to have to yell at the younger one, what damage that will do to their relationship and their sense of self. So I'm not saying the schema might not have been worth it in the moment, but the problem with schemas is that they tend to generalize. So what started out as a compulsion to yell at younger brother could easily generalize as this felt need to yell at any child who's making mistakes. Again, there are incredible costs in the ways we learn to protect ourselves or others, which is why this kind of work is so important. Okay, so go back to this first point, that schemas have two elements, the knowledge about a problem or suffering, and knowledge around how to avoid it. One reason I want to slow down and describe this structure is to bring us to a second really important point about schemas, And that has to do with how incredibly specific they are. I don't think our field has done enough to communicate this point to the public or even to our therapists. Yes, we've gotten the word out that if you have a psychological struggle, there's likely something underneath to explain it, maybe even some kind of learning. But then we tend to talk about what's underneath in general terms. Like, well, if you experience trauma, your nervous system is just generally keyed to danger, so it will likely have trouble settling. Well, that's true and might be very useful to know, but it doesn't shed light on the nature of my particular inner landscape of learnings. Similarly, we like to help people place themselves in overarching categories like an attachment style. I think knowing one's attachment style is super helpful, but all of that is still general. And yes, while we are in many ways similar to each other, or to other people who've experienced trauma or have an avoidant attachment style, let's say, we are also incredibly unique. And that is a truth that coherence therapy deeply honors. That when we're struggling with a psychological issue, there must be a very particular learning around the nature of some problem and its solution, or occasionally lack thereof, which I'll speak to in a moment. These are highly specific knowings, not general ones. They aren't just, well, relationships are dangerous. They tell us what kind of danger, how do I know when to predict it, and then of course, how did I specifically learn to manage it? That sort of belief structure is as unique as a fingerprint. Appreciating this uniqueness is important because unless we locate a person with high specificity, it is difficult to actually create a complete shift. Now, this specificity is possible because the unconscious mind is not a vague dreamscape that can never really be clarified or put into words. No, the deeper brain is actually highly orderly. In fact, in coherence therapy, we generally avoid using the word disorder because we don't believe the mind is disordered. It's ordered. That's why our deeper knowings lend themselves well to being what Eckhart calls cloaked in language. Now, the second reason I wanted to highlight the structure of a schema and why we want to cloak that structure in language is that it gives us a place to start clinically. When we are working to update a schema, we can now choose either to focus on updating beliefs around the nature of the problem, once we've uncovered it, or the nature of its solution. In the example of the mom who finds herself yelling at her kids, updating information about the problem might look like her deeper mind really finally taking in that the threat of dad has fully passed. However, I just want to acknowledge that for some problems discovered, they are actually true and continuing problems. But then we still have the chance to work with the solution side of the schema. Because it's very likely that whatever solution our unconscious, often young brain developed could use further developing. There may be other, much less costly ways of protecting ourselves or getting our needs met. Now, let me make one final point here. Sometimes we bump into schemas that know something about the nature of some problem, but rather than being linked to a required solution, it's linked to a sense of there being no solution. With a schema like that says, at any point I could experience the torment of being humiliated and there's no way to prevent it, that kind of schema will almost invariably present as some kind of panic disorder, especially if the schema is one around the existence of some type of danger. So there's a lot to say about different ways to work with this kind of schema, and really that gets into how to work with trauma, because that's what makes traumatic experiences so traumatic, right? There was a danger, and I felt powerless to stop it. There was no solution, or the solution really was not enough. So in those kinds of cases, what might you do? Well, you might be able to integrate a sense of new solutions or resource if they are available. After all, even when there weren't any solutions or resources at the time, or in that particular moment, it's possible there are now. This could look like inner child work, where you go back to the moment this child was alone and really had no way to protect themselves, and have the adult step in to fight on their behalf, so that the brain can really take in, I do have power now. Another example of how this sometimes look would be through somatic work, because when we're facing overwhelming physical threats, it's easy to embody a sense of like, I'm too frozen or small to protect myself. So reaccessing and moving through one's fight energy and feeling one's physical power can really serve as a disconfirmation in that case. It's like evidence of, yes, I do have a strong body that can fight. Of course, you don't only have to work on the solution side in terms of trauma. You can also certainly work on the danger side. This is often really important because when trauma memories are left unprocessed or unintegrated, it's almost like they leave us with a schema that says, I'm still in the scene of the danger. I'm about to die. That's just really common with trauma where what happened in the past feels like it never ended. In that case, the disconfirmation would need to have some element of returning to the present and to the reality of having survived. Again, you could do that through visualization. For instance, seeing the moment of the trauma scene and really letting yourself know you made it through and are safe now. Gosh, there are so many techniques used in trauma therapies that you could draw from. Now, before we end, I do want to point out one final possibility, which is that the emotional knowing that there is a deep suffering, but without solution, is actually true. There is a deep suffering. Perhaps my dear partner has a terminal disease and there is no solution. So working to update a schema using memory reconsolidation wouldn't fit because the emotional truth is fully reality-based. However, there is another innate process the human brain has developed for such moments, and it is called grief. Thank you for joining me in this deeper dive into the nature and structure of schemas. Before we end, I just want to make one final point. You know, in some ways as therapists, we have two choices. We can choose to focus on trying to manage our client's symptoms, or we can choose to focus on uncovering the urgent purpose underneath, the schema that makes that symptom necessary to have. If we can do that, and if we can work to shift the schema, the symptom will resolve naturally without our having to fight or struggle or try so hard to change through sheer will. If this way of working seems compelling to you, I encourage you to watch the next video. In it, I will be interviewing Bruce Ecker, who co-created Coherence Therapy and is the primary national trainer of the model. If I've piqued your interest in coherence therapy, please stay tuned for that conversation. I'm Dr. Tori Olds, and I so appreciate your watching.
Welcome, friend, come inside.
Thanks so much for watching. If you're a therapist who has enjoyed my free content and think you might want to train with me, there are a few options. Now, these options do change year by year, so I'll try to put the current information in the description box below and keep that updated. But as of today, I offer both online courses that you can work through at your own pace, ranging from 2 to 10 hours of content, as well as online training groups. I also have a core training called Minding the Heart that meets weekly for 6 months and explores how to master and integrate a number of different experiential approaches. As of now, I offer CEUs for all my trainings, but again, please check below for updated information. And as always, thank you so much for watching.